Here's an overview of some of the items that we discussed at our November Trust Board meeting. We received an update on the domestic abuse services and how the Southern Trust is meeting its responsibilities under the Domestic and Sexual Abuse Strategy and the Strategic Framework to End Violence Against Women and Girls. One statistic that truly stood out was that a report of domestic abuse was made to the police on average every 18 minutes. That's a powerful reminder of how many people are affected and why this work matters so much. If you or someone you know is experiencing domestic abuse, please remember that help is available. Women's Aid offers a 24-hour helpline, and you can call anytime on 080 8802 1414. We were joined by Dr. Pat McCafferty, and she shared with us an update on how the Trust is improving services for our older people living with frailty. It was great to hear about the work happening across the areas like reablement, single discharge teams, day hospitals, rapid access clinics, hospital at home, and the new frailty approach at the front door. Our goal is simple. We want our older frail patients to be seen, diagnosed and treated as quickly as possible, and to get them back home again without delay. Even better, when care can be safely given at home, we want to make sure people don't have to leave their home at all. It's all about helping people stay well, stay safe, comfortable and independent. We got an insight into our learning disability services and the challenges we've been facing here, particularly in the Southern Trust. And that's moving young people's services into our adult services, providing short breaks and placements and managing delayed discharges. These have all been difficult, especially with staff shortages and growing demand. What encouraged me most was hearing how the team is working hard to make things better for the people who use our services and their families and the staff who support them. The board received the Southern Trust Winter Plan, and it was good to see the work happening to support our timely care programme. The focus is on better ambulance handovers, avoiding unnecessary admissions, improving flow and speeding up discharge and strengthening care in the community. In simple terms, it's about managing admissions well, keeping patients moving and helping people get home sooner. We can all help by choosing the right health service for what we need. When we use the right options, like self-care, pharmacist or GP, mental health services, or maybe minor injuries or urgent care, it helps keep emergency care for those who really need it. I've used the phone first service myself and have found it incredibly helpful. I explained what was wrong and they directed me to the right place. And for you, that's whether it's minor injuries, urgent care, your GP, or indeed the emergency department. The number is 0300 123 3111. And finally, flu season is here and has arrived earlier than expected. Getting your flu vaccination is one of the best ways to protect yourself, your loved ones and the patients we care for across health and social care. You can get your vaccination through your GP or your local pharmacy. For health and social care staff, vaccines are available across the Trust. It's all about helping you, your family and the people we care for to keep them safe. So get the vaccine and not the flu.